Working in the prone position, we can do all sorts of things to the neck muscles. We can do some pickup petrissage into the upper traps, as well as into the posterior neck muscles. You can even get some nice warming by doing a pulling stroke, but make sure you are sinking into the tissue. You can do a variation and pull up in through the lamina groove. And while working the lamina groove, we can do a little pickup petrissage into the posterior neck, and then narrowing our focus into the lamina groove, focusing on circular friction to those tight muscles that you can also work in supine. You can come in with heel of hand or palm and work the upper traps. Make sure as much as possible your fingers are facing forward. And then we can bring the work into the lamina groove again and do some circular friction at the end into the occipital ridge. This is a variation on the one in your iTunes U course. We're going to drag our fingers up through the lamina groove, and the opposite hand is pushing down on the pecs. And then we'll just switch and switch, creating a nice lengthening in the posterior neck muscles. So this is the neck face scalp lesson, and as much as we're going to be working posteriorly, some cautions at this point in your education. We don't want to be working the front of the neck, and definitely not in front of the SCM muscle here, so that we stay away from the carotid artery and the anterior triangle. All right, so then we can start with some milking of the upper traps, working into the lamina groove bilaterally, seeing some movement in the head because we're getting decent pressure. Then we can do some circular friction into the lamina groove, identifying and dispersing any tension that may be in the muscles, working in to the occipital ridge, and just doing some nice tight circular friction, working all the muscles that insert there. Then we can move to the opposite side and repeat. Finishing with the neck, we can come into the scalp, gliding up from the neck and working in behind the ears and pulling on the ears, working our way into temporalis. Temporalis is a muscle you'll work a lot when clients have TMJ or temporomandibular joint syndrome. Remember that temporalis is more than just the cliche rubbing of the temple. The muscle covers the whole side of the head. You can work on the sagittal sutures, just pressing in, leaning in with your body. Don't do it with your muscles. And just bringing your thumbs together, running down the midline of the skull. You can also take your hands and just squeeze on the head. Feels quite nice. And maybe finish up with some gentle hair pulling. All I'm going to do is move my fingers through the hair and just create a soft fist, lifting the aponeurosis off of the skull.